Hello everyone, welcome back to my channel, the Halat Africa Show. If this is your first time on my channel, please subscribe, click on the notification bell, and don't forget to like the video. As the saying goes, a healthy nation is a wealthy nation. And for that being the case, today we're going to talk about the health challenges that we are facing in the Gambia. But before we get into a discussion proper, I want us to first watch a very short video, press conference for that matter, that was organized by the health professionals in the Gambia, most notably the nurses and the midwives, talking about some of the challenges that they face in doing their work as healthcare professionals. And once we come back, we are going to look at some of the challenges and also perhaps the opportunities that we have in the health sector in the Gambia.
Kasama, I'm the vice president. I decided to just sit behind, just to be part of the general members. So, talking about this shortage of materials, this is something that has been ongoing. Since we joined the health system, it's something that has become normal in the health system. The government doesn't really care. Ministry of Health does not care. Hospital administrations or hospital management who we think will work with us, they don't really care. I'll take an example for myself. I have some of my colleagues here. I worked in the ICU and the accident and emergency unit. You come to work, you have one piece of glove that you will use to give medication for the whole ward. You can have a patient of a ward of 15 patients or 20. You will use one glove to give medication. When you come to syringes, I was on night duties. We will go to the duty room. They will count how many patients do you have in your ward. For example, if you have 10 patients, they will give you 10 syringes, needle and syringe. I will use one needle and syringe for your 10 p.m. medication. I'll keep it for the 12 a.m. medication and keep it again for the 6 a.m. medication for one patient. I'll put you at risk, put the other patients at risk, and put myself at risk. Sometimes we work without gloves. I have cleaned a patient who messed up without gloves. My colleague is there, Sira. And what we got at the end of the month was they deducted $1,000 from our salaries because we could not have gloves to clean that patient. This is not just about saying what of the things that is happening. Mere oxygen, patients cannot have it. The energy you use running around the hospital to get resources is far more than the energy you put in taking care of the patient. That is what is happening all over the country. And when it comes to health equity in the Gambia, it's zero. Not everybody is equal when it comes to healthcare service in the Gambia. I've seen a couple of times, we have patients, they'll bring them into the ICU when they are not supposed to be there. The less privileged are dying somewhere when they need the service. But because you are from a high income or whatever class they categorize you, or you are from a VIP, either a minister also, they bring you there, or you will need a resource that is not available in the hospital currently, but it is in the store. Because you are a nobody, you are poor, you have no connection with anybody at the government level, nobody will come from their house to bring out that resources that you need. We are all human beings. But if somebody from the ministry of government, whatever sector, or you are part of the government facilities, heads or whatever, as long as you are considered as VIP, somebody will come out from their home, whether it's 3 a.m. or 4 a.m., to bring out whatever resources you need and give it to you. But the lay person, who is a less privileged person, will not have that opportunity. So we lack gloves in the hospital. Medications are never available. Hospital beds are never available. So it's normal to go to a hospital in the Gambia without hospital bed seats. But whenever somebody is coming from the ministry or the president is coming around, our so-called leaders will make sure even A&E, the beds, will have bed seats, which I feel is cheating. That is not supposed to be done. You know?
Thank you.
So I'm so emotional. I don't normally talk like this, but I will just end my talk here.
We have all heard from the lady there who talked about so many things, some of the challenges that they face in the healthcare sector, talking about lack of equipment, lack of medication, and then also the corruption which is within the system, and then the classism also within the system, because she talked about the way people are treated in the Gambia. If you are from the higher class or the upper class, you are giving VIP treatment. But if you are nobody, most of the time, you are left at the mercy of the system. And we know that healthcare is a right, is a fundamental human right. So therefore, as a developing country, we should invest more into our healthcare system. That way we can have healthy citizens. And once we have a healthy citizen, we will be able to develop. Because a healthy nation is a wealthy nation. But let's look at why is it that we are having all of these issues in the Gambia. I mean, number one is corruption. We know exactly what is happening. We see it every day happening. Wherein you go to the hospitals in the Gambia, you cannot have access to medication. When they prescribe medication for you as a patient, you have to go outside, go to a private pharmacy to buy those medication. And what usually happens is the very people who are working in these public hospitals, they are the very people who have private pharmacies outside. People are stealing from our resources, from the medical system. They're stealing medications to go and sell it just to serve their selfish interest. And I think months ago I did talk about corruption within the healthcare system in the Gambia. And if you guys are interested, you can go to my channel. You will see that there. But apart from the corruption that is in the system, the other difficulty that we're having is lack of adequate investment on the part of the government. Because here we're talking about public hospitals. That is under the responsibility of the government of the Gambia to make sure that our public hospitals are properly funded. And when we look at the statistics from 2018, the Gambia government spent about 3.09% of total GDP towards our healthcare system. And when you look at that, it is very small, because healthcare is a very important component of our government. So therefore, I expect that the government of the Gambia will give priority to our health sector by investing more money into that sector. But 3% is a very small fraction of our total GDP. And it goes to show that our government is not taking the health of the Gambian citizens seriously. Because if they are serious about it, they would have spent more money to make sure that we have a healthy population. When you look at developed countries, their health spending is in the double digits. But some people might say that is a very unfair comparison. But let's look within our region itself. For example, the country of Sierra Leone in 2018, they spent over 16% of their total GDP towards their health sector, which is a huge, huge investment, because the government of Sierra Leone understand the need to have a healthy population. So the Gambia also can do the same thing to make sure that our public healthcare system is functioning adequately, and they are providing quality and affordable service to the Gambian people. The other issue that we have within the healthcare system, I think, is because the government of the Gambia is depending more on foreign aid, foreign support to finance our healthcare system in the Gambia. We have to understand that development itself comes within. We cannot depend on foreign aid to develop our country. So therefore, a government that depends on foreign aid to develop its healthcare sector is most likely to fail. And this is why in 2018, 2019 to even 2020, you look at the maternal mortality rate in the Gambia. I think in 2020, says 221 people die per every 1,000 live birth. A small country like the Gambia, having that much women dying as a result of childbirth, which is not their fault. This is a natural phenomenon, it's a natural process. We expect our women to get married and then start families. But it seems like it is very risky in the Gambia for a woman to be pregnant because our healthcare system is not adequate enough to guarantee that they will carry that baby for 9 months and then give birth to that baby without compromising their life. I remember last year, the women in the Gambia had to protest under the banner, Gambian women's life matters, because a lot of young women were dying as a result of childbirth. I have a mother, I have a sister, and I wouldn't wish that to happen to any of my sisters, and I wouldn't wish that to happen to any of our women. The right to give birth to a child shouldn't be that difficult and complicated in our country if our government is serious in investing in the healthcare system. But this goes to show that our government doesn't give much attention to the healthcare situation that we're having in the Gambia. And we also have a lot of children who die immediately after birth. Infant mortality also is an issue in the Gambia. So these are some of the challenges that we have in the healthcare system in the Gambia. And they say where there are challenges, there are also opportunities. So I am urging on the government of the Gambia to spend more money on the healthcare system. They need to invest more to make sure that we have very good public hospitals across the entire country. And if you should travel to the rural areas in the Gambia, the women who are living in those areas, they are even at more risk, because the further you go up country, the poorer our health facilities become. As a country, we should have an even distribution of our health facilities, making sure that no matter where you are in the Gambia, as a woman, you can conceive, go through pregnancy and give birth, knowing that nothing is going to happen to you. So therefore, my appeal is the government of the Gambia should be serious, because we need to save the lives of our women. They are part and parcel of us. They are part and parcel of our society, and they are one of the most important people in our society, because women are the backbone of the Gambian society, whether we like it or not. So therefore, anything that threatens their life should be taken very seriously. But to you, who is a private citizen or anyone from anywhere, if you have the means to invest in healthcare delivery in the Gambia, this is a huge opportunity. And I'm appealing to each and everyone who has the means or who have the means to invest in this sector. Please do so, because it is going to help the Gambian people, especially our women. And I have done a video also on investing in healthcare in the Gambia. You can go to my channel and look at that video. So this is the short video that I have for you today, and I hope in the near future we will see a very productive public health sector in the Gambia, so that what is happening to our women will come to an end, so that Gambians will not find the need to seek medical care outside of the Gambia, because we know medical care outside of the Gambia is very expensive, and for the most part Gambians would go to Senegal, they would go to Dakar to seek for better medical treatment, when in fact we could do better to make sure that each and every Gambian will not find the need to travel overseas to seek for medical attention. And with that, I come to the end of this video. Peace out until I come your way another time. Bye for now.